Here's when things go wrong in the cardiovascular system. Hypertension, high blood pressure, silent killer, all the same thing. Vessels are under such high pressure, but the patient's unaware of it. In the case of hypertension, the ventricles are exerting enough pressure to cause damage, and then as the vessels are damaged, they become less elastic, and so now the heart has to pump harder. We have a positive feedback loop. Positive meaning one thing leads to another. Positive doesn't mean good in this case, because we get stroke, heart attack, kidney failure, aneurysm. What is an aneurysm? Well, it's an abnormal widening of an artery, often due to hypertension, but not always. Sometimes people inherit those weaknesses. What do? Well, we watch and wait, see if it's growing. Often it's in a place that we don't want to conduct surgery, such as an aortic aneurysm deep within the tissues. Hypotension is low blood pressure, and this happens often when there's a lot of blood loss. And then the blood volume drops, and the victim goes into circulatory shock. So fairly serious. But hypotension can also be caused by just low blood sugar. So it can be serious, maybe not serious. Generally, if the blood pressure is less than 100, but you got to look at your patient, their age, their skin color, how they're behaving. You treat the patient, not just their numbers. Hypertension, 140 and above. For most people, resting needs to be below 140. Atherosclerosis, this is sometimes called hardening of the arteries, and that's due to these low density lipoproteins. I call these the lousy dudes. These are, if you look at my diagram, a protein that wraps around cholesterol, and it's going to be sticky. At least that's how the theory goes, and it's going to block the artery. And so once beautiful slick artery becomes blocked up with these LDLs. High density lipoproteins, I call these the heroes, the hero dudes. They bind to cholesterol, but instead of clogging up the vessels, they are transported to the liver, where they're mixed. The cholesterol is mixed with bile, and it's kind of a greeny substance, and then it's going to flow to the intestines and out of the body. Now, there's some evidence that exercise, diet can help, but often we inherit our HDL, LDL numbers to some extent. If there's too many LDLs, they'll start to infiltrate the artery walls, which you can see the example in this diagram. Not a good thing, because now they're sequestered away in a place that it's hard to reach. We can't just go in there and scour them away. And slowly the lumen size of that vessel is going to decrease. This poor fellow, the lumen is far less than a fourth of its original diameter. And when this happens, there's several procedures. One is, well, before I get to the procedures, one is just the plaque is, and take a look at this, you'll see how we can, look at this, this is a blood vessel, and there's the artery, and right above it is the vein. See, and if you turn it in a certain way, you can see the lumen and whether the patient has a lot of calcium, platelets, fibrin attached to that wall, because the body's trying to prevent you from bleeding to death. And so, yeah, it saves your life, but then you have a plaque that's going to cause you problems later. Angina pectoris is a symptom, often a chest pain, when there's a blockage of the coronary artery. The myocardium, which is a muscle of the heart, is not getting enough oxygen and glucose, and then wastes are building up, and so it starts sending us a pain signal. The chest, sometimes the back, left hand, depends, different for different patients. Deep vein thrombosis is when there's plaque buildup, thrombus occurs, and that thrombus will break off pieces, and those are called an emboli or embolism. And the pain is often typically in the calf, but it can occur anywhere. in the body. And it's not always an old person. Sometimes teenagers will get DVT. Gangrene, we see this sometimes in people very poor, living under a bridge, or just not getting access to medicine. Circulation dies, it slows down in the extremities, tissues start to die, and then the bacteria are going to invade this. Oh, it's a really sad thing to see. And you can smell it. It's real evident. CHF is when the left ventricle myocardium, the muscle, dies, and due to, say, a myocardium infarction, blood and fluids are going to back up. And this is when you sometimes see pulmonary edema, fluid in the lungs. They just can't seem to clear them. Or sometimes the calves, the legs also store fluid. AMI, that myocardial infarction, I've talked about that. The death occurs to oxygen starvation, not enough glucose. What do? Well, we have plaque busting drugs, collectively called statins. Think of Plavix, Lipitor. There's many that are going to reduce the rate at which people deposit plaque. A more immediate solution is nitroglycerin, sublingual, just under the tongue. And this is going to be a temporary dilation of the coronary artery, just to keep the patient alive so they can get treatment quickly. Angioplasty, that's a surgical procedure. It's really quite amazing. If you get a chance to see a cath lab procedure, I recommend it. I saw one at Memorial. It's used to reduce some of the blockages in the cardiovascular system, and it started with a catheter. Now, the patient is conscious. Kind of amazing. They put them in a passive sedation, so the patient will feel some pressure, and you can talk to them, and that's good because you want them alert. It increases survival rates. The procedure involves the insertion of a stent, but first a catheter is placed, and that's what these physicians are doing. They're placing the catheter. It's a long tube. Usually the first catheter is a pig cat, and then depending on the patient's condition. And after the plaque is whisked out of there, a stent is put in so the blood vessel doesn't collapse. Coronary bypass is when a blood vessel from, let's say, from the back of the thigh is removed and stitched there on the ascending aorta so that the blockage is bypassed. Sometimes the descending, I've seen in cadavers the bypass from the descending, so this backside is stitched in. So whatever works, often. Varicose veins, we see this sometimes in people that are heavy or pregnant, but we inherit this as well. It's when the valves are stretched and weakened and then blood pools above those valves. It's a positive feedback loop because the more pressure, the more swelling, the more damage, and on it goes. Arrhythmias, they can be irregular, like tachycardia, measured with an ECG. That's when we have over 100 beats per minute that's not involved with exercise or not due to exercise. And you can see it on the right, the monitor. It looks like you can see the QRS waves, but where's the P? Where's the T? There's no resting cycle. And so there's not enough blood being perfused to the tissues. V-fib is dangerous because the ventricles are large, and that the electrical impulses are causing erratic muscular contractions, and so insufficient blood is being pumped. There's not enough perfusion because we need that slow, smooth pumping action to drive blood all the way to our toes and our fingers and our ears. An AED can be used in some conditions, all right? You can't, it's not like in the doctor shows where they just put the paddles on everybody that's about to die. No, there's only certain shockable rhythms, and the AED will tell you. You attach it to your patient, push the button, and the device tells you whether you have a shockable rhythm or not. AFib or flutter is fairly common. If you've ever been just sitting somewhere quietly and all of a sudden your heart flutters and it's kind of frightening, it tends to be a temporary. We think of 100 to 150 beats per minute. Unless it's chronic, it's something going on all the time, it's usually not a problem. An ECG will show an absence of P waves. I talked about that. In the case of AFib, the F waves are there, and see those little in the lower diagram. So in the upper you can see the P, the lower you can see the F's. It's interesting. A panic attack will sometimes cause angina, and a person rushes to the hospital thinking they have something serious, and it's just anxiety, which is still serious, but not always life-threatening. Endocarditis, when bacteria enter the blood. This is why sometimes we don't have dental work done on a patient that's just had surgery, because the mouth is a good place for Staphylococcus, among other bacteria, to enter. And sometimes that bacteria will attack heart valves. And if the patient's not treated quickly, we get sudden heart failure. This is one of those things that's hard to detect. You don't see it coming. Rheumatic fever, we sometimes see this in all sorts of, even children. The body is in a fighting an infection, a streptococcus infection, and pretty soon the body's antibodies, they will attach. They'll attack strep, but by accident they attack the heart valves. So it's kind of an autoimmune disorder where we're hurting ourselves, and I'll say more about that in a different unit. Myocarditis, unfortunately, we see this in many people of college students that are sometimes chugging beer, or they're introducing massive amounts of drugs or substances to the body. The heart can quickly become inflamed. The myocardium, the muscles of the heart, and of course infection of bacteria and viruses cause the same thing. So we have to be cautious when we consume substances that are toxic. Right? Spread them out. That six-pack should take us a week or more to consume, not one evening. All right. Good luck ahead.